Coming up tonight, I have equine surgeon Dr. Rachael Smith talking to us about lameness. Right after Dr. Rachael, I have Truman, the true bulldog who has this excessive desire to hump. Now, it's not what you think. Take your places. We're going to be back in just a moment. Welcome everyone, it is that time of the week again. It's the Animals Television Show. I'm your host Romy Bueller, and I have a great episode particularly for the horse lovers out there tonight. I have equine surgeon Dr. Rachael Smith joining me, and she's going to be talking to us about lameness, what it is, how you can recognise it, some of the common problems that cause it, and then when to seek help. Right after Dr. Rachael, I have Truman. Truman is a bulldog that I have spoken to in the past, and he's a very funny dog. First up though, let's go have a little chat to Dr. Rachael Smith. Welcome Rachael, thank you so much for joining me today. I'm excited to hear what you've got to say today because we've got a topic that I'm sure there's many people that have issues with and would love some information. But first, I would love to hear a little bit about, because you're from country New Zealand originally.
Yes.
And perhaps that had a little bit to do with it, but how did you first want to become a vet and then working with horses as opposed to small animals and things?
Good question. And I think those who love horses will relate. But yeah, so I was brought up in central South Island, New Zealand, on a sheep farm. And for as long as I can remember, I had a very deep-seated love of horses. So I was a bit of a farm girl at heart and eventually got my first pony after a lot of begging when I was 7. And since then, really, I don't ever remember not wanting to be a vet. It was a lifelong thing. So I grew up riding ponies, horses through my schooling years. And and I guess that seated the interest in becoming a vet. I loved all animals and had all animals. If you talk to my parents, our house was a menagerie of acquired baby animals of various versions, from possums to magpies to ducklings to horses and lambs and calves. So I loved all animals, but ultimately I did want to end up being an equine vet. And further to that, I wanted to specialise in equine surgery in order to have a complete understanding and ability to help and save and see a case through from, admission and presentation to surgery, whether that's life-saving or career-saving, and also seeing the horse, home. So it was sort of completed what I wanted to achieve for the animal, I guess, in a sort of in its entirety. And so not only do I do surgery, but obviously deal with horses that have musculoskeletal disease such as lameness, and it's about enhancing and improving their well-being and welfare to ensure that they can live the life that they're desired to live or that they desire to live.
Yeah. Oh, great. And speaking of lameness, because that's our topic of conversation today, I'm just going to sit back here and look nice, and you're going to just teach people or share people some really interesting information that can help them. So I'm going to hand the baton over to you, Rach, and go for it.
Yeah. So lameness is a bit of a pet project or a pet subject of mine that I've developed with over nearly 25 years in the profession. So it's probably, lameness is probably one of the most common causes of lost days of use or wastage in equine disciplines. And to back the truck up a little bit, a lot of people, and certainly a lot of my non-horsey friends, hear me talk about lameness and they're like, well, what is lameness anyway? When I say I'm doing lameness exams all day. So for those of you that don't know a lot about horses or don't understand what lameness is, essentially lameness is when the animal shows a pain in one or multiple legs. So it's essentially limping. Now, the interesting thing about horses, just a bit of a background, is because they are prey animals, in their sort of in their development of survival mechanisms, it's not in their interest at all to show any weakness. Otherwise, a lion will pick them off the back of the herd and target them for dinner. So when, as people and as animals, we like symmetry. That's symmetry in appearance, symmetry in motion. So when a horse is not lame, it has a very symmetrical and smooth gait. And we particularly see this at the walk and at the trot and at the canter, where their gait is a pleasure to look at. It's got symmetrical timing, symmetrical weight bearing. There's no favouring of any legs. There's no sort of stilted or jutted movement. So the horse looks strong. So the problem with horses, as far as owners and vets goes, is they really have to have a problem before they show us what the problem is. So it's in our interest to sort of learn how to pick up these subtle signs and learn, what lameness is just a little bit of grumbly stiffness and soreness, and they warm out of it, to what lameness is actually quite important to the animal's welfare and needs veterinary attention. So essentially lameness is defined as asymmetry in movement by the horse favouring putting weight on their sound legs more than sound non-painful legs more than the painful leg. And we see this most easily at the trot, okay, because the trot is a symmetrical gait. So that means it's a 2-time beat where on the left and right diagonal, so the left fore and the right hind bear weight at the same time, and then the right fore and the right hind bear weight at the same time. So it's a 2-time symmetrical gait. So and that's easy for us to look at with regards to the canter, which is a 3-time with a period of suspension, and the walk, which is 4-time, where they've always got 3 feet on the ground at the same time, so we don't see it as clearly. So as owners and vets, we like to assess lameness when the horse is at the trot, and the easiest way initially is to see it in a straight line. Now, then we divide the lameness into, is it a forelimb lameness or is it a hind limb lameness? And there's a few little rules of thumbs or, things that I sort of teach the students about in the vet school here about when you're learning to detect lameness, what do you look for to determine what leg the horse is sore in? And not only do we have to do that, but then we have to grade the lameness. And the importance of grading the lameness is for us to be able to communicate to other people, whether it's in the profession or owners or people that might be looking at buying the horse, for example. We need to be able to communicate on a universal scale how bad the lameness is. And typically we use a 1 to 5 grading scale. So 0 out of 5 being no lameness at all, 5 out of 5 being the horse is completely non-weight bearing in the affected limb. So that's obviously a serious lameness. And grade 2 lameness is when we don't see it consistently on the straight line, but if we put the horse on a circle in one direction or the other, or a harder surface, then we may see a consistent lameness. Bearing in mind that most lamenesses are exacerbated when the affected limb is on the inside of the circle, and most lamenesses are exacerbated on a firmer surface versus a softer surface. So a grade 3, for example, is a lameness that we see easily every stride when the horse is trotting in a straight line, and a grade 4 is lame at the walk, obviously lame at the walk, and very, very lame at the trot. So this is the scale that we use. So, and obviously different conditions and problems cause different grades of lameness. And that's where it's important for owners to understand, you know, what's serious and what's maybe not so serious, i.e. when is urgent attention needed from a healthcare professional. So, in terms of determining what leg the horse is lame in, we have a little rule of thumb in the vet profession where we say down is sound. So for forelimb lamenesses, we look at the head movement. So when a horse is lame in a forelimb, the head will nod down every time the sound leg hits the ground. So you'll see people looking at horses trot and they'll go down, 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 down. And they'll be nodding along with the horse with its head. So we say down is sound. So if the horse is nodding down on the right forelimb as he bears weight, then we know that it's a left fore lameness. So down is sound is a really nice rule of thumb, because you can just watch the horse and just kind of go down is sound. So for a lameness that you don't see easily at the walk, then when you see him at the trot and you get this constant head nod, then we know that the head nod down is when the sound leg is on the ground, and sound means non-painful, and therefore the other leg is the lame leg. So that's the leg you want to investigate. And when we lunge the horse in a circle, when we go in a left direction, so anti-clockwise, a left fore lameness will often be a lot more obvious. And when we lunge it to the right direction or clockwise, then the right fore lameness may be more obvious. Now that's a generalization and not always the case. So mostly with foot-related lamenesses, it will be exacerbated when the inside limb is on, when the affected limb is on the inside of the circle. Occasionally with soft tissue injuries, the contrary might be true. So these are just guidelines. So that's kind of what we do to, assess which leg the horse is lame in. So the forelimb is very obvious. A forelimb lameness is very obvious. Owners feel it, riders feel it. You can see it from the ground. The horse looks lame, because 2/3 of the horse's weight is carried in the forelimbs, whereas the hind limbs are more a propulsive. That's where they generate the force to push the body forward. So they're not so much a weight-bearing structure, they're more of a pushing structure from behind. So hind limb lameness is a lot more difficult for owners and vets to detect, because horses are very good at offloading the painful area and putting it somewhere else. So it's not quite as apparent as the forelimb. And common sort of signs or common complaints that we hear about hind limb lameness, the horses, it feels sort of off behind. It's not pushing through. The owner might complain of the saddle slipping to one side, or the horse is dropping away from behind them, or doesn't want to transition from a trot to a canter. So it's more sort of hind limb propulsion transition stuff that we see in a hind limb lameness. But when we're assessing the horse from the ground, we look at the gluteal movement. So again, at the trot, when horses are trotting, doop, 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 the gluteal rises when their limb is on the ground, and when they bear full weight, they push off, and as the limb swings forward, the gluteal drops. So if a horse is bearing weight and pushing off with the same amount of force on the left and the right hind, what we see is a very symmetrical gluteal movement. If a horse is lame on one of its hind limbs, one, it doesn't want to bear as much weight, and two, it wants to get off it quickly. So you get this sort of action where the lame leg will be carried lower, or there's greater or more rapid drop in the lame leg because it wants to get off it quicker. Yeah. So the gluteal with the most amplitude of movement and the most rapid drop in movement is the lame leg. So that's when we're assessing it from behind. And other things we can look at is the horse tracking up with the hind limb effectively, and is it bearing weight into its fetlock as much as the non-lame leg? Like, does it want to sink its weight in, or does it brace like that before pushing off? So that's kind of a simple, not so simple summary of what we look for in a horse that has either a forelimb lameness or a hind limb lameness. Now, before I move on, any questions there, Romy?
I do, but I'll just see where you go with this, because you might actually answer them as we go through. But no, that's really, really interesting. And I can imagine actually that it would be, for some, it would be quite difficult to determine, because there's a lot of things to look at, but having that real power of observation of when you're on the horse or just observing from the ground as well. And actually kind of similar in ways where with a human, if you roll your ankle, or if you've got something, you kind of lift your head up, or when you're kind of hunching over into it. So it's a similar thing in some ways.
Yeah, so the principles of biomechanics are similar. Essentially, we want to unload the sore limb and favour loading the sound. So horses do that, but unfortunately, because horses have four legs to sort of spread the change in their weight, and because they are the masters of compensation, so this is where it becomes difficult sometimes for subtle lamenesses or performance relating or performance impacting lamenesses, is that horses don't readily show us where their weakness is. They'll develop all sorts of subtle compensatory sort of, I'll carry this weight here and move this a bit differently. And what we see most commonly secondary to that is for hind limb lameness anyway, is actual back pain, because they sort of, it has to go somewhere. For every offload, it's got to be an onload. So we'll get compensatory, back pain, because they take it up the kinetic chain of movement. So it becomes, complicated. But for the purpose of today, essentially, it's down as sound for a forelimb lameness, and for the hind limb lameness, when you're looking at it from behind, it's the gluteal that drops the most. And riding under saddle, it's often a feel for riders. So once we determine what leg the lame is, and obviously if the horse is non-weight bearing lame, or it's it's showing you it's sore, then we don't need to go through those sorts of things. But obviously there is different types of lamenesses, and probably another little rule of thumb is that often owners think there's pain higher up. They're like, they'll come to the vet and go, it's a shoulder lameness, or I think it's up in his hip. And the horse may have tension in the muscles higher up the limb, but 90% of all lamenesses the cause of them is localized below the knee and below the hock. So the lower limb is the cause of 90% of all lamenesses in horses. And the foot is by far, across the board, the most common cause. So the foot is the first point of contact to the ground. And that's the point at which the proprioceptive feedback goes up the rest of the body to tell that horse how much it wants to load that leg. So foot things are very common. And if you've got a backyard pony or a backyard horse or any horse really, foot-related problems are quite common, and often they're not serious. So it might be something as simple as a crack in the hoof wall that's got, separated to the sensitive lamina tissue. And, another thing that causes quite severe lameness that's very common is foot abscesses, or what we call subsolar abscesses. So when we talk about severe lamenesses, i.e. when the horse is, almost non-weight bearing lame, there are not many things that cause that type of lameness. The most common and the most easily treated with the best prognosis is a subsolar foot abscess. So horses, and usually the lameness, the horse might be fine one day, and over 2 to 3 days, it'll go to almost non-weight bearing. And you may think that that horse has got a broken leg. And the reason why the horse is so sore to a foot abscess is that just like when we whack our nail with a hammer and it wants to bleed, there's nowhere for it to bleed. There's nowhere for inflammation or pus to go. So it causes a lot of pressure of inflammatory exudate or hemorrhage or whatever's caused it within a very tightly confined hoof capsule. Okay, so horses walk on our third digit. So our fingernail is the equivalent of a horse's hoof capsule. So that's how they've developed, or how we developed through evolution. So basically horses walk on the equivalent of our middle finger, and the whole limb is elongated so that our wrist is a horse's knee and our heel is a horse's hock. So they have very elongated lower limbs, and that's through evolution to ensure that they can run at speed to escape predators. So moving parts need to be light to have a high cadence and to establish speed, just like a cyclist with pedals and wheels. Horses have low redundant weight in their lower limbs, so they have just what's needed. They have tendons, they have bone, they have ligaments, they have skin. And essentially that allows their lower limbs to fly through the ground at speed and to be very fast and very light. So that's how they've evolved to walking on their fingernail. So essentially the hoof capsule is a very tightly confined structure that doesn't like to have bleeding or pus accumulating under it. And it's a very robust structure to the environment. It withstands forces. There's a hard sole, there's a hard frog, there's a hard capsule. But occasionally there'll be compromise to that, and there'll be a little bit of, there may be a crack that allows introduction of infection to the sensitive tissue, and then the infection establishes itself and sort of wants to go somewhere, so it tracks under the sole, and they become incredibly painful associated with that. So much that they, it's like our throbbing foot. They have heat in the foot. They have bounding pulses to the foot. You can pick that foot up, and even with thumb pressure, sometimes you can find where the painful abscess is, or where it might be. The beauty about a foot abscess is that when you find out where it is and can drain it, the farrier or the vet, so will need it to drain, they'll find a little spot and drain it. It provides instant relief, and often within minutes the horse will be walking more comfortably. And so with some anti-inflammatories, tetanus prophylaxis, and some foot poulticing to draw that fluid away from the tight structure, the horse becomes very sound very quickly. So that's one thing that causes quite severe lameness. The other thing can be infected joint or synovial structure due to a penetrating wound into the foot or into any sort of joint in the lower limb. And the other thing is a fracture of the limb. So there's three main things that cause severe lameness, all of which need urgent veterinary attention because the horse is very painful. Foot abscesses have a very good prognosis. A joint or a synovial structure infection needs urgent medical and surgical care. And mainly the diagnosis or understanding that that's what's going on is important. And obviously the third, a fracture of any limb, is very critical and needs urgent veterinary intervention. So severe lameness needs attention. But if you're out and, out on your own and you have a horse that is very lame, there are some things that you can look at to kind of self-triage and to help you understand whether you can move the horse or whether the vet needs to come to you, or whether you call the farrier to check for the foot abscess rather than the vet if you can't get a vet. If you can't get a vet to a lame horse, a farrier is a very good next option. And sometimes the farrier is actually quicker to get to a foot abscess than a vet may be as well if you don't have horse vets in your area. So that's kind of important to understand that. So things that you can do is, one, identify which leg is sore. Sometimes it's obvious, sometimes it's not. And then two, we get back to this symmetry. So luckily for us, horses have a left and right of their legs. So if you've realised what leg your horse is lame in, then what you can do is start from the bottom and work up, feeling and palpating the structures up the limb. And it might be as simple as testing the hoof wall temperature on the left compared to the right. If it's a foot-related lameness, often there's a marked increase in warmth to the hoof wall of the affected limb versus the unaffected. There may be swelling in the sore limb versus the other limb. There may be a puncture wound that you might have to split the hair or really feel hard and lift the hair and feel for any little defects. But if a horse has a puncture wound and infection is seeded there, then you can get marked swelling and what we call cellulitis, which is infection under the tissues. And again, compare the left to the right. And the other important thing to look at is the tendon contour. So the tendons at the back of the cannon bone, you can feel down them compared to the other limb. And also puffiness of joints or increased fluid within joints. And obviously, if a horse is really painful, you can pick the limb up and just palpate, down the bones, down the soft tissues, trying to determine where a horse, might tell you it's painful. So there's those little things that you can do, at home, to try and establish, what your next course of action is. And like I said, if it's foot related, the farrier can be really helpful if you don't have a really accessible vet. But any lameness, i.e. the horse is lame at the walk and you can see it's painful, you really should seek veterinary attention to help rule in and rule out, significant problems and identify where it is.
Such great information, Rach. Are there a breed of horse or breeds of horse that are more susceptible to lameness? Obviously, ulcers and things like that are different altogether, but have you seen horses that are more susceptible? I don't know whether they have different slim legs or things like that.
Yeah, so definitely. So the lameness predispositions relates to not only breed, but more importantly, probably discipline and use and age.
Right.
So when we talk about, if we're presenting a case, for example, if someone rings me up and says, I've got this horse, we say, what is the signalment? And the signalment of an animal is essentially its age, its breed, and its use. So I might, so if someone says to me, look, I've got a 3-year-old thoroughbred filly, she's just done her, second sort of fast gallop of this prep, and she's pulled up lame in the left fore, and she's got a bit of heat and swelling around her knee, then immediately I'm like, oh God, yeah, she might have a knee chip or bone remodeling pain associated with that knee. So what a horse does really reflects on what sort of lameness we might be thinking of. Whereas if someone said, I've got a 12-year-old, Grand Prix dressage horse who's just really just started struggling doing pirouettes and resistance to, transitioning to canter on the right rein, then I'll be thinking, there may be some low-grade hind limb lameness going on here that's probably suspensory branch injury or, osteoarthritis of the hocks or the fetlock joints. So there's certainly categories, there's certain causes of lameness, whether that be acute traumatic, repetitive cycling, or age-related degenerative change of soft tissues that we're like, this is high on our differential diagnoses list. We need to look at these areas, and these are lower down on our differential. So it'd be very unusual for a sport horse to get knee pain, whereas it would be very common for a racing horse to get knee pain. And then, certain breeds like ponies, your Welsh Mountain, your sturdy Shetlands, etc., they are as robust as they come. Hardly ever get lameness because they're tough, they are barefoot, they've got good foot quality, hardly ever get foot abscesses. But if you get a thoroughbred where they are notorious for their thin sole, thin wool, poor hoof quality, flat foot, they are very predisposed to foot abscesses if they have the husbandry where they're out in a paddock and not, shod every 4 weeks and undergo intense husbandry and care. They sort of sound like low maintenance just to put them out in a paddock, but we've bred over the years for very fast animals, but with fast animals, with racehorses, come poor foot quality. So we have to look after these horses because of their poor foot quality. They're not as good out in a paddock herd situation, whereas, ponies can be. But then you have ponies that are predisposed to metabolic diseases, such as equine metabolic syndrome, which is your fat little pony that gets laminitis, or equine Cushing's, which is the hairy pony that's predisposed to infections and laminitis as well. So they're very, predisposed to getting laminitis, which is a severely painful condition if they get over-ingestion of carbohydrate-related food, such as green grass, etc. So certainly there is pre-breed and discipline predispositions that always send little red flags or ding-dongs in vets' heads as to where they're going to look and what they think might be going on.
That's just so interesting and so much valuable information for everybody out there. Rach, it's been really great chatting with you. Or I didn't do too much chatting, but really, really great listening to you, because I think there's certainly a lot of people. I mean, it's a common problem, isn't it? So there's a lot of people out there that can just take what they need from that, and then, as I've said in previous shows, to rewind and replay, because some of this information, will be suitable for later on, when you come across this problem. So thank you so much. I hope we can get the encyclopedia of all things horses, Dr. Rachael Smith, back on with us at some point so we can learn a few more things from her. So thank you so much for your time.
Pleasure.
It was a pleasure to have you with us. Don't go anywhere, problem. Everybody. We are going to be right back with Truman in the chat box. The Animals Chat Box is the segment where I get to have a chat with some of our viewers' animals. Now, it's not a verbal conversation like I'd ordinarily have with someone. It's a conversation using the language of animals where we transfer images, words and feelings from one to the other. I can smell on behalf of an animal, I can taste what they taste, hear what they hear, I can feel in their body what they feel. And you can gather a lot of information communicating this way, from behavioural issues to emotional and mental health issues. I can taste their food and I can feel in their body where they're unwell or where they're injured. This is often referred to as animal communication. Right now, we have some animals waiting for us in the chat box. Let's go see who they are and what they've got to say to us today.
He adds so much personality to this house. I don't know what we would do without him. Just such a big, bright energy. Like I said in his bio, he has a big heart and an ego to match.
He's a funny guy, just to make people laugh and just change their energy.
Yeah.
So, that's kind of his job, is to be the comedian.
Yeah.
And I think he does that quite well.
Yes, he does. So I know I was not sure whether to ask that question or not about the humping, but it has been an ongoing issue since he was a young puppy, and it never seems to let up at all. We've asked other people about it. Truman kind of has the attitude like, that's just what guys do, so I'm going to do it when I get the urge. But it is a little embarrassing going to dog parks, and he just won't, when he finds one he loves, he just will not let up. I mean, there doesn't even have to be a dog there sometimes. He's just, when he's in the mood, he'll just be air humping or, yeah.
So let's have a look at that, because this is not kind of where I thought it was going to go. When I first asked him about this, I just get, it's almost like a Tom Cruise look where the sunglasses come down to the nose and he looks up. It's like eye rolling. That's my thing, man. That's what I do. Yep. I'm a man, I'm a dog, and I'm pretty cool. So there is definitely that element of being a cool dude, and it's a manly thing to do. But what I see it is as an energy block. Now, if you can imagine a scratch that you can't itch, that the itch is really deep, and you scratch the surface of your skin, but the itch is deeper than that, and you're scratching and it's just like you're just not quite getting it. Or there's another sensation for some of you that may have experienced this, where you need to urinate and you've finished, but there feels like there's more there, but there's no more there. There's a lot of energy down in that base chakra, second chakra end, the tail and the legs and the pelvis and all in there, that is just blocked. Humping to have an end result or an outcome, there's no outcome. So you can kind of imagine just in a feeling how that would be for him.
Yeah, sure.
So you got to keep trying, don't you? So you hump and nothing happens. You don't get that final feeling of release. And so you go again. From his point of view, it's actually kind of frustrating.
I'm sure.
From yours, it's embarrassing. From his, it's just like, I want to get it. I want that energy to keep flowing through me. So I just want to see whether something like an energy healing, or I'm getting shown hydrotherapy. It's this movement thing. It's like you keep moving the front and the back legs and the energy keeps moving through the body. Energy healing for animals. It's that idea of pulling energy through, pulling it all the way through. He would like a solution to that, actually. And so he has his really funny part. He's got the star Truman, and then he's got his kind of serious side. So he would actually like some kind of resolution to that. Loves his food. It's like Christmas has just arrived.
Super excited to eat now, but he still feels he's not getting enough food, of course.
Yeah, he's so full. Don't be conned, because he's a little manipulator.
I know this. Yeah. I did think of one other thing. He, of course, he's always been a super fast eater. Slow feed anything, doesn't matter. He just inhales it.
He's having trouble with his shape of his face and his mouth to get food in. It's easier for him, almost, I'm just getting shown like a vacuum cleaner style. It's easier just to kind of inhale it and suck it in. There is something that he wants to say to you. He's a little bit busy singing at the moment. He doesn't have a very long attention span when you're talking to him. He goes off on tangents. He thinks you're marvelous, and that's the word he used. You're marvelous, and your work ethic is exceptional, and you need to have fun more. And when you have fun, his whole world changes. When can we go into the car again? Has he been on a ride lately?
It probably has been a little bit since I've taken him on a ride. I'll have to make sure we do that.
It's actually so people can see him.
I know.
So he can see other dogs and other people, but it's very much about how marvelous he is and that and he also says he's really quite striking to look at. He draws a crowd because he's so striking.
He actually does. Yes, he does.
How's his sunglasses going? Because he's just asking when he's getting his sunglasses.
Oh my gosh. Oh, that's funny. You know what? That's hilarious. I absolutely I forgot actually that he wanted sunglasses. We have so many pairs of sunglasses. I could find him a pair.
I don't feel like he's overly hydrated. Does he drink much? And I know sometimes dogs drink a lot. They look like they're drinking a lot, but not a lot is going in.
So since we started this new program too, I mean, he didn't really drink much before, and now he's like barely drinking anything.
Right.
I think it has to do with a lot of fruit and the veg, but yeah, it's summertime. He should be drinking more.
He'll be getting some hydration through his food,
yeah.
But I'm just getting shown that he's a little dehydrated, and what you can do to entice him is put a little bit of beef stock in his water. We can get like ice cubes and put in there, but it's very salty, so you don't want to do too much. It's just like a hint of a flavor that can draw them in to drink some more water. So because it's drinking it and actually getting it to go in and down.
Yeah. I used to add some watermelon juice too. He loves watermelon.
He does like that very much. And that actually feels like a good fit for his makeup as well. So if you've got some watermelon, keep that in mind. He absolutely loves his life. He's really, really happy. He couldn't have chosen a better home if he tried. His job is to lighten the energy in the house. He's thoroughly enjoying the fact that he has a reason to get out of bed in the morning.
Truman's reason for getting out of bed, though, is food.
Yes. He doesn't like the way you say that. He's laughing when he says it. He says that's a little accusatory. The truth hurts, buddy.
Yeah, it does hurt.
Well, Truman, it has been a true pleasure to have you on the show this evening, and Mum, of course. We can't have Truman on here without Mum. So thank you, Megan. Thank you, Truman, for joining us and sharing with us some really invaluable advice. Actually, I found that very interesting to talk about. Might be an embarrassing topic, but it's actually a really valid conversation to have about the humping. So thanks so much for joining us, and thank you everybody for watching. Stick around. We will be right back.
Make your day richer with The Richard Wilmore Show. Meet amazing musicians, talented actors, brilliant authors, hilarious comedians, and the most creative people in entertainment. Download the KP Media TV app to watch on Apple TV, Roku, and Amazon Fire.
That's our show for tonight, everyone. Thanks so much for tuning in. Don't forget to subscribe to the YouTube channel and follow and share the pages around. Thank you for watching. I'm Romy Bueller. I will see you back here this time next week.